Hello. We're taking non-communicable diseases. Non-communicable diseases are diverse groups of chronic health conditions that are not contagious. That's why they are non-communicable. They are the largest group of diseases that have the highest ratio of adult mortality and morbidity worldwide. And this, according to the chart, these groups have the largest deaths worldwide, and they are common diseases that we all know. They include, but are not limited to, cancer, cardiovascular diseases, every form of heart. Anyway, they're not. So every form of heart conditions, hypertension, cardiovascular generally, diseases generally, diabetes, chronic respiratory diseases, cancers, all forms of the non-communicable diseases, even mental health related, they are all within the cadre of non-communicable diseases, and they are the leading cause of premature death globally. All these cases are chronic diseases in medical conditions. Chronic medical conditions. What are some of the risk factors? Lifestyle behaviors, behavioral risk factors, metabolic risk factors, as listed above, I mean, in the chart. Um, Environmental factors and social demographic factors. Poverty is linked with NCDs generally. So that's on that one. And then other risk factors include medical conditions and genetic or hereditary, like sickle cell anemia, hypertension. Hypertension is both medical and genetic, because it can be inherited. Preventions are modifying all the predisposing factors, the lifestyle and care of oneself. investing in better management patterns of care. A person who or a client who has predisposing factors should just maintain a lifestyle of care, of our utmost care to ensure that is not that as long as you are predisposed to it, to these NCDs, that you are automatically how would I say, automatically free from eventually being diagnosed or having these conditions because of lifestyle modification. It's just that the person has knowledge now, and knowledge is power. So it's somebody that knows that um, it has a high rate or high risk of predisposition to hypertension, to avoid a lifestyle that would trigger a level of hypertension that could be unmanageable or more serious than like a patient that has a predisposing factor for hypertension should avoid things that will modify his life into chronic hypertension in quote, as in someone that knows that he has a predisposing factor should avoid things that will make the hypertension even beyond the capacity of most regular medications or most lifestyle modification that can aid a better level of hypertension, because hypertension is also in degrees. Diabetes is in degrees. Diabetes, somebody can have diabetes and live with diabetes for the rest of his life and live old and healthy in quotes, in manageable health. Let me use the word manageable health, than somebody who does not even know what it means to be predisposed to hypertension and doesn't know that his lifestyle are aiding him to complications of the hypertension, or making the hypertension even more grievous than it is. The fact that somebody has hypertension doesn't mean the person cannot live a normal life, cannot live his life or her life without the mind of being hypertensive at the back of his mind all the time. No, it's not written. It's not going to be living a life with a stigma on his forehead or her forehead. So anyone with these NCDs, knowing that they have an inherited predisposition, should be able to be in control with knowledge, with lifestyle modifications, with medical help or aid, early managed, early, with the right resources, right medical help on time and on time. Because it's one thing, like I have an example of a child. He's not a child, but he's still a child. He's about 16 years old. I met him, and during practice at the outpatient department, he wanted to see the doctor for symptoms of queried malaria. And during the vitals, with the vitals, I observed that the vitals was pre-hypertensive. It was even beyond pre-hypertensive. Pre-hypertensive is like 120 something, 128 over 80 something, but he was having 140 plus or 150. And I checked his record. I realized that it has been a pattern, and it has been consistent for some years, which nobody felt that, or according to him, nobody talked to him, nobody counseled him on, which I had to do. In the process of counseling, I found out that his parents were both hypertensive. And I had to encourage him that the fact that the parents are hypertensive and the quantity, the gravity of medication that the parents are taking daily, the fact that those parents are in that categories of people doesn't mean he should be. He was like, how he has assumed that his fate is going to be that way. And I said, no, your fate shouldn't be that way, because you knowing this now, start your medication and care early. start your medication and care early so that complications that your parents are managing with the hypertension, you will not have them. You will just have hypertension that is hereditary that can easily be managed because it is part of your genes, not hypertension inherited with that became aggravated by complications that arose along the way due to mismanagement or lack of management of the hypertension. So investing in better management is critical. Better management is critical. Examples of some of them, like the cardiovascular disease. Cardiovascular disease are any diseases relating to the heart and the blood vessel. There are many, and they result in they are not limited to this list, but they are more, they can be more, they are more than that. Of course, they are more, they can kill, they can destroy a person. One of them is hypertension. One of the cardiovascular diseases are hypertension. This is just elevated blood pressure above the normal. Elevated blood pressure above normal. It is important to know that the blood pressure is a normal thing. Your blood has to have a pressure, and the pressure is the force that moves, that the blood moves through the circulatory system. So when this is abnormally low, slow, or abnormally high, there will be it will show signs. It will show signs to in the body with different manifestations. And the flow of blood is needed for excretion of waste, because it is during the flow, movement of blood in the blood. We should know, or we already know that in the blood has the oxygen, carbon dioxide, your nutrients, your electrolytes, everything is being passed through the circulatory system. That's why it is the circulatory system, the transport system of essential nutrients and blood to every tissues, every cell of the body. So it also is the place where excretion of waste it passes through. So there has to be a constant flow and at a particular rate or pressure. And whereby the rate of pressure is altered, then it will present as either low blood pressure or high blood pressure. Examples of the normal blood pressure. Example of the blood pressure. Examples of the blood pressure, as I said earlier, below 120, 80 is expected, the normal expected blood pressure. Elevated or pre-hypertensive from 120 to 129 to over 80. In the before now, it was maintained that pre-hypertensive was 140/90. That from 140/90, a patient is informed of the need to start working on his lifestyle modifications, changes, checking his blood pressure, taking his blood pressure and lifestyle seriously. But right now, it's even from 120 over to 129. By the time somebody is having a blood elevated systolic of 120 to 129, the person should be on the alert to change his lifestyle, modify it in a way that to be healthy. So hypertensive stage 1 is 130, 139. Hypertensive stage 2 above 140, while hypertensive crisis or emergency goes from 180 and above, while the diastolic is 120 and above. So the diastolic of 90 and above is already hypertensive stage 2, whereas in the olden days it was a diastolic of 89 was pre-hypertensive. So at the end of the day, from research and changes and technology, we realize that the an individual with a systolic of 139 to a diastolic of 89 was already having complications of hypertension, whereas it was assumed that they are still in the pre-hypertensive state. Another type of CVD, cardiovascular diseases, are cardiac failure, and not a popular one. And it's when the cardiac output is reduced. There's congestion, there's ischemia. Ischemia is when there is loss of ineffective oxygen exchange of the tissues. And if the heart is inefficient due to valve damage or vascular resistance or damage, there will be hypertension because the fluid, there won't be enough output of blood. There will be reservoir, so there will be damage to the tissues of the heart. Depending on the factors, cardiac failure can affect either side of the heart, either the left or the right. So there could be left ventricular failure and there could be right ventricular failure, depending on the causative factor. I'll be using terms that I expect you guys to know. Then there is also biventricular failure, when both sides have failure, not just one-sided. That will be evident with edema, tissue, swelling of the legs, the lungs, and there will be breathlessness because of that. There is no cure for all these diseases, NCDs. There's no cure for them, but they can be managed effectively if taken care of effectively with strict adherence to medication and lifestyle medications, modifications, and the likes. There's also ischemic heart diseases. That's a reduction in oxygen, reduction in the flow of blood through the myocardium, which is the innermost layers of the heart. It will cause tissue damage and death, and of course, the heart will not be healthy. It's one of the thing that one of the condition that it arises in is called angina. Angina could be stable or unstable. Angina is due to that reduction in oxygen and the flow of blood in the myocardium. There will be constriction of the myocardium with the muscles, and then the person will be feeling pain in the chest and will be wondering, will be having the fear that probably they're about to die because of that. It could be triggered by even stress, and the drugs needed include nitrate, potassium channel activator, beta blockers, and calcium channel blockers. They aid in the heart muscles contracting better and releasing more blood out of the heart, emptying of the heart, making it effective for more fresh blood to come in as it should. There's myocardial infarction. That one is death of part of the myocardium due to disruption of blood supply. All this you can see as if there is a pattern, they go hand in hand. One doesn't go with the other most of the time. There's arrhythmia. Arrhythmia is disorders of the conducting system of the heart, remembering that the heart is a muscle and its muscles have conducting system, and whenever that is ineffective, it will also bring about symptoms relating. All these symptoms of the heart CVDs are interrelated. So until a proper investigation, cardiogram, um, echo, ECG, the blood, lipid profile, investigations are done, electrolyte and urea are done to ascertain the extent of damage or to ascertain the depletion, what is depleted in the blood of the individual, whereby we know what needs to be replaced. Sometimes even some of them signs manifested to determine what needs to be done quickly. Good communication, care, medications. At the end of the day, it's also needs, we should be mindful that the relations has to come in, the family has to come in for effectiveness of care of some of these cases, most of these cases, sorry. Then there's diabetic mellitus. That is another popular NCD. Is a group of metabolic disease in which there's an elevated blood glucose level over a prolonged period. It is usually a chronic disorder, and there is no cure for diabetes mellitus. There are the most three common types. There's type 1 and type 2, and there's gestational diabetes mellitus. Type 2 is the most common one. It's deficiency, um, deficiency in insulin resistance to the body. There's insufficiency in the glucose manufactured or in the manufacture of glucose, and it happens over time. It's not something that happens suddenly. It happens over time and gradually becomes a permanent, as in it start manifesting worsen. Let me use the word worsen with evidence in the life of the individual. Type 1 is absolute deficiency. Type 1 is absolute deficiency, and this is usually hereditary. It's absolute deficiency. It's from birth, it's inherited. There's deficiency in beta cell. The beta cell is the one that is manufacturing the insulin. So then gestational, this one is during pregnancy. And some women just develop without any particular reason. We develop type 2 diabetes develop diabetes in pregnancy, and after pregnancy, only during pregnancy. After pregnancy, the blood glucose almost comes back to normal. But others, if not managed properly, will become type 2 diabetic all their lives. There are other types as well. But diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. So type 2 may be treated with medication or without insulin, weight loss, surgery for those with obesity. I think we can stop there. We can continue tomorrow. You have a beautiful, beautiful day. Bless you.